And thank you to the organizers for the opportunity to present on a topic that I think is quite important, medications, and why it is important to be engaged and know all we can about what we take. And just as a disclaimer, I will not be saying take this versus take that, because our approach is not a one size fits all. So I will talk about general guidelines and recommendations that each one of us can take to help with the medications we are taking. And thanks to Dr. Carrillo, we heard a little bit about things that we might be able to do to improve our health as we age, including maintain a healthy brain. And these are things we can all, hopefully we will get soon a recipe for the right combination of physical activity, memory exercises, and diet that can help us maintain our health and brain health. But also the lack of these factors, or medical illnesses, social isolation, uncontrolled depression, or poor diet can negatively impact our brain and our health in general. But I would challenge you to think whether there are other factors that we might maybe miss when we think about what can we do and what are factors that can negatively impact ourselves. And I don't know how many of you had considered medications and all the medications you are taking, and how whether they are needed, whether they are appropriate, or they might pose more risks than benefits. As we age, we are more susceptible to the negative effects of medications, including some that we might have been taking for a long time. And some factors are things that come with aging. These are what we call age-related changes. There will be a decrease in kidney and liver function that is affecting our own body's ability to clear drugs. Drugs will be more likely to be able to get to our brain if we are taking them. And the brain itself might be more sensitive to the effects of the medications. So this might be things that we don't necessarily have the ability to directly impact. However, there are also factors that we can control, like polypharmacy and prescribing cascade. And these are things that I would like to address further. These are what we call modifiable risk factors. We can all be aware of the risk, and we can all be proactive in addressing them. When I talk about polypharmacy, that probably the most accepted definition for polypharmacy is the use of multiple medications by an individual. And 5 or more is the typical cutoff for defining polypharmacy. What some might not be aware, and this is very important to consider, is the fact that when we talk about polypharmacy, we don't only talk about prescription medications. We include here everything that a patient might be taking. It could be the over-the-counter allergy relief medication that you pick up from your pharmacy when you stop for at the grocery store. It might be some vitamins and supplements that you take because you might have seen an ad on TV, or maybe your friend recommended to help you stay healthy. Everything adds up, and we need to know what we are taking, because otherwise there might be problems down the road. And it is important to consider all the medications and be aware of the number of medications we are taking, because just by the fact of taking more, we are more likely to have at least one medication that is inappropriate for us as an individual patient. They might be fine for our friend, but they might be posing risks for our own health. And what you see in this diagram on the bottom of the slide is information that came from a study that looked at medication use in a representative sample of the US population. And what I would like to point out to is the fact that almost 40% of the population included in this study, 36%, 36.7% to be precise, were using 5 or more medications. And this was, as I mentioned, what we call polypharmacy. But even if they are not in the polypharmacy category, as you can see in this diagram, even taking 1 or more medications, it's still increasing the risk of having an inappropriate medication. And when I say inappropriate, it means the risks that come with taking that medication outweigh the potential benefits. And just to give you an idea, this is coming from our research study here at the University of Kentucky. Dr. Van Eldik mentioned our research, and some of you might be aware of the INCREASE study, which is looking at medication use, and we are trying to optimize treatment to evaluate whether that has a positive impact on cognitive function. And we look to see, when we enroll participants in our study, what were the most commonly encountered problems with the medications they were taking. The top 3 that we identified were problems with the indication for that medication, problems with the dose they were on, and problems with the fact that a specific medication was interacting with something else that the patient was taking, thus increasing the risk of adverse events. So when I say indication, it might be the fact that, a drug was prescribed 10 years ago. It was all, justifiable, but 10 years later, there might be issues with continuing to take that medication. The same with the dose. Those might be, as we age, we might be considering lowering the dose that a patient is taking. So again, something that was completely appropriate at the beginning of the treatment might be inappropriate a few years later. And the same with drug interactions, because medications are being added on a continuous basis, right? So there is always the potential for an interaction between 2 medications that somebody is taking. This is kind of like a schematic, a map we thought of putting together to really see what is the list of medications that we identified, again, from our study participants as being potentially inappropriate and potentially causing more problems than benefits. And based on what's here, you can see there is almost anything you can think of can be found in this list. And what I would like for you to take as a message from what I'm showing here is the fact that, again, as I mentioned, there is not a one-size-fits-all approach. What might be completely appropriate for one patient might be inappropriate for another one. So it's not, you look at your friend and you see they are taking a proton pump inhibitor, they go and get ranitidine because they have maybe experiencing some, tummy aches, and they are doing fine. And you might think, well, those might be safe. It might not be safe for you. So you have to be aware of these potential problems. The other issue that can arise with medications, and they are more prevalent as we age, is it's what we are calling a prescribing cascade. And what a prescribing cascade is a situation in which a medication is being prescribed because the patient is coming to see their doctor with symptoms, but those symptoms are not necessarily related to a new disease that they experience. The symptoms are the result of a side effect from a medication that they are taking. And those side effects might not be recognized as side effects of the medication. So a new medication is being prescribed to address the problems caused by another medication. And you might see this becoming a vicious circle. So we can go on and adding more medications that cause more problems. And at one point, this vicious circle might be hard to break. So by now, I hope I convinced you that it is very important to think about the medications we are taking and to really be aware of what we are taking and think of whether there are ways we can do better. So I guess the next logical question is, can we do anything? And if yes, what is that? And what I would like to present here is our approach and what we would recommend in terms of addressing the problem that might be caused by inappropriate medications. And this is a risk-benefit balance approach that is individualized, is taking the patient needs, values, and preferences into account in trying to find the right balance for the individual patient with regard to risks and benefits. So again, it's not a one size fits all. Every patient is different. So if you are a patient or you are a caregiver, you should consider that and ignore what's happening with your friends or other patients. Just focus on the individual risk and the individual benefits of taking anything. So a few things that one can do, again, it is for yourself as a patient, or if you are taking care of somebody that is taking many medications. Few things that one can consider to really maintain the safety of taking prescription or non-prescription medication. It is always important to keep a current list of all the medications that you are taking. And again, I will emphasize, this should be either prescription, so something that the doctor prescribed to you, or anything that you take over the counter, vitamins, supplements, everything should be included on the list. And the list should be updated on a regular basis as things might change over time. For every medication, you should be tracking, making sure you know the dose you are taking, you know how the medication was recommended for administration. It might be helpful to pick up all of your prescription and over-the-counter vitamin supplements from the same pharmacy. And if you don't yet, make sure you get to know your pharmacist and make sure you feel comfortable talking to them about the medications you are taking. Whenever you pick medications, your prescription from the pharmacy, make sure you are checking what you are getting and make sure that is really what you were prescribed. There might be times when errors happen, so always check the prescription when you pick it up. If you are recommended to start a new medication, make sure you do so when somebody is around. So don't start a new medication when you are on your own. And look out for changes once you start a new medication and be aware of the potential side effects and adverse effects of taking the medication. Be aware of the prescription cascade. So again, if you experience a new symptom, make sure you discuss it with your doctor and rule out that is a side effect of the medication rather than a new disease. ask for a medication review, and ask whether you can reduce the number of medications that you are taking if you feel like you are taking too many. And I will also highly encourage you to always ask your doctor and the pharmacist about the medications you are taking. You should be engaged in the care, and you should be comfortable discussing these issues with your doctor and pharmacist. Ask them, why are you taking that medication? What are the potential benefits and harms that come with this medication for me as an individual patient? Can this medication affect my memory or cause me to fall? Can I stop or reduce the dose of this medication if needed? And again, very important, who do I follow up with and when? So make sure this is a longitudinal and ongoing process, that it's not once you start the medication, you are staying on it without question until the doctor might tell you to stop. So this is all I had in terms of recommendations, and I would like to thank you for your